Good morning, everybody. I'm trying to. Okay. Good morning, everybody. My name is Jeff Harris. I am a psychologist I work as the director of counseling at New Mexico State University. So I'm in southern New Mexico in the southwestern part of the United States. I'm about a mile, 1 hour from Ciudad de Juarez in Chihuahua, Mexico. But so that's where I'm at. As you can see, we've got people from all over the world. We've got people from Europe, from Turkey, from Japan. So one of the things I really like about the Society for the Exploration of Psychotherapy Integration is that it's a very international organization. And so I get to meet people all over the world. And so I'm excited that all of you are here and decided to spend some time learning about unified psychotherapy this morning. So I'm going to give you kind of a brief biographical introduction to myself and to give you a sense of where I'm coming from and how I came to be here talking with you all this morning. So in 1990, I graduated with my PhD in counseling psychology from Ohio State University. So that's the diploma right there that you can see over my left shoulder. In the counseling psychology program at Ohio State, we were exposed to different theories, but there wasn't an expectation that we would choose one orientation. Many of you went to programs where you had to decide whether you were a behaviorist or psychodynamic or cognitive. But we didn't have any pressure to choose one orientation, but there was exposure to different theories. So there wasn't a pressure to choose one, but there also wasn't any formal instruction in how to integrate ideas from different theories. So I would describe my training as both eclectic and common factors. In about 1995, I think it was December 1995, I went to the Evolution of Psychotherapy conference, which is a big conference that they hold every few years with big names. And it was when I went there, it's like, oh, wouldn't it be cool to learn a little bit about all of these different theories? And so that was, I think, the first kernel for me becoming an integrationist. In about 1996, at a professional conference, I had a couple colleagues present on the formal idea of psychotherapy integration, and they introduced me to this book, which is the first edition of the Handbook of Psychotherapy Integration, edited by John Norcross and Marv Goldfried. So that was the first time that I got the idea that I wanted to be an integrationist, or I wanted to learn how to practice psychotherapy in a more integrative way. After that, I was working in the late 90s at the University of Hawaii at Manoa, and I taught a elective class on psychotherapy integration for some of the students in their clinical psychology program. And I realized that how I practiced integration and practice was different than the way some of the formal models described. And what I noticed was, instead of choosing, am I going to do this theory, I noticed that I often was combining different skills from different sources together in the same session or with the same client. So I started trying to articulate what I was doing and how that was a little different than some of the other models. So my first effort at describing a method of integration was called skill-based psychotherapy integration. I had to dig around in my study at home this morning to see if I still had this. So this is a 75-page Kinko's book. I went to the Kinko's and got the little plastic binding, 75 pages and only a handful of references. So this is the fun part. This is the easy part. I presented this in 2001. So I've been working. So this is version 1.0. So in 2001, I continued to flesh that out. Version 2.0 is this book, Integrative Multi-Theoretical Psychotherapy. A few people who read the book liked it. Not many people found the book, and it's out of print now, but I'm willing to share copies of chapters with you. In fact, I sent most of you an email yesterday or this morning with some documents directly related to this webinar, as well as 3 chapters from this book. And I'll continue to be sending you materials throughout our training this summer. So I've been going to SEPI, the Society for Exploration of Psychotherapy Integration, for about 20 years, and have presented there and have met colleagues there. Barbara Ingram is participating today. She's heard me tell this joke before, but when I met Barbara Ingram at SEPI in Boston many years ago, I came to her presentation. She came up and introduced herself and said, "Oh, I'm really glad that you came to my presentation. I came to your presentation last year, and I think that what we're doing is really similar." And then for the next 15 minutes, I listened to Barbara's presentation and I said, oh no, Barbara and I wrote the same book and hers is coming out a year before mine. Luckily, after about 15 minutes, I was like, oh, Barbara is focusing more on case formulation and I'm focusing more on skills. And maybe these ideas are complementary rather than competitive. Obviously, in the spirit of integration, we want to find where our different ideas are complementary rather than seeing them as competitive. So over the years, I talked to other members of SEPI who were trying to do similar work that Barbara and I were doing, and to have kind of look at some big picture models that fit together most of the psychotherapy theories in a meaningful way. And so in 2015, some of us met. Jeffrey Magnavita organized a unified psychotherapy summit. We agreed on the word unified. One of my jokes about publishing a book with the word multi-theoretical. So here's a joke is, what's the difference between a unified framework and a multi-theoretical framework? And the answer is multi-theoretical has 7 syllables and unified only has 3. So we'll see if marketing goes any better with a 3-syllable word rather than a 7-syllable word. So we met, several of us SEPI members met in Cape Cod in 2015 and 2017 to compare what we were doing, and we agreed on a definition of unified psychotherapy that I'll talk about in a few minutes. So this is training in unified psychotherapy that I'm pilot testing with you this summer is kind of version 3.0. And I'm excited because I've been thinking about this stuff for 20 years, and I think my ideas have gotten better and more refined, and they're more refined because I present to folks like you and you ask good questions. So that's my kind of biographical introduction. I'm going to go ahead and get the slides up if I can. I'm going to give a couple more people permission to talk. Okay, so I think everybody has permission to talk. So if you have a question, there'll be a few times that I have set aside for specific questions. But if you have a question, just the easiest way to do that will just be to turn on your camera and ask a question. So we're going to practice that. So Barbara, will you turn on your camera and ask me a quick question to see if it works? Okay, will Barbara or Will or Susan ask me a question? And we have 2 Susans. So anybody named Susan, ask me a question and see if that works.
Jeff, this is Susan Prieto Welch. I don't really have a question.
Okay, you don't have
just checking to see if this works.
It works. So thank you for being a volunteer. So I was trying to remember I could ask you a question about a restaurant in Lafayette, but I won't. So, okay, so if you want to ask a question, just turn on your camera or turn on your microphone and ask me a question. But there'll be a few times Oh, so Will says I can't see the option for showing my video. Okay, so I have a allow to talk button. Okay, so okay, so I guess you can't, I can give you permission to talk, but the settings for the webinar. Okay, so okay, live and learn. So I can't see your smiling faces, but I can hear your pleasant voices. So if you want to ask a question, turn on your microphone and say, hey, Jeff, I have a question. Okay, so at this point, you should be able to see one title slide that says becoming a more integrative psychotherapist. And so at this point, I cannot, let me see if I can do this a different way. Okay, so at this point, I cannot see the chat box. So if you do have a question, you'll need, chat's not going to work. You're going to need to pop in and say, hey, Jeff. When we get to some of the structured question or reflection points, I will open up the chat box again. So this is training in unified psychotherapy level 1. So this is 5 sessions. We're going to be talking about working interactively with cognition, emotion, and behavior. If you choose to participate in the second level of training, that'll be later in the summer, and that will be working contextually with internal and external influences. So the outline for today is I'm going to be introducing you to a definition of unified psychotherapy and talking about how that differs from other routes to integration. I'm going to be presenting you with a 3-tiered model of human functioning. I'm going to be presenting to you a unified framework for individual psychotherapy, which will be kind of complex. So then once we get kind of complex, we'll go simple, and I'll suggest a simple foundation for training people to think about psychotherapy in an integrative way. We'll do, I'll introduce you to the idea of unified treatment planning, which will include a demonstration of a multidimensional survey with a client. So as I said, several of us members of CEPI got together in 2015 and 2017 to define unified psychotherapy. So this is a picture of Andre Marquis, Jeffrey Magnavita, me in the middle, Greg Henriques and Ken Critchfield. And this is the definition that we came up with. Unified psychotherapy seeks to enhance practitioners' capacity to draw from the diversity of approaches, processes, techniques, and research findings by providing an evolving, comprehensive, and holistic framework. So we'll be talking about that for a lot, but I want you to think about a holistic framework. So holistic framework is the punchline there. So if you've been involved with CEPI, or if you know the literature in psychotherapy integration, there are 5 routes to integration. So in the 1992 version of the handbook, there were common factors, technical eclecticism, and theoretical integration. In a chapter in this book, Stan Messer suggested the idea of assimilative integration, and that has been fleshed out. And so those of us who met in Cape Cod and a couple other folks like Barbara Ingram and Jack Anshin are suggesting that unification is a 5th route to integration that is more, it is different than these other 4. And so the idea here is that it's a meta-theoretical approach that places theories, techniques, and principles into holistic frameworks. So there's that word holistic framework, and then we'll talk a little bit about what a meta-theoretical approach is. So I'm going to suggest to you today that these 5 routes to integration can be put together in a developmental process. and they differ in complexity. So if you're looking at this slide on the bottom left-hand corner, those are low in complexity and take less time to develop over time. And then as we move up these stair steps, they increase in complexity and the time that it takes to master this. So I'm suggesting that common factors approach to psychotherapy integration is a good way to build a firm foundation by emphasizing learning micro skills and emphasizing the therapeutic relationship. Assimilative integration involves finding your comfort zone. Technical eclecticism is used to expand your repertoire. Theoretical integration is a way to fit the pieces together, either in a formal way or an informal way. And then unified psychotherapy is looking at the big picture. So I put our little up logo there. So this is the moving on up graph. If you watched television in the 70s, you might have watched the Jefferson show that has this catchy theme song that I still remember 40 years later, moving on up to the east side to a deluxe apartment in the sky. So this is my moving on up slide. So this is a picture that that Greg Henriques developed to describe unification. And Greg suggested that each of the original theories of psychotherapy, and he's got 6 on this little map: multicultural, family systems, cognitive, psychodynamic, humanistic, and behavioral. Each of the primary schools of thoughts is like an individual mountain. So Greg suggests that psychotherapy integration is like finding a pathway between 2 mountains. So you might have been raised in I was raised in the humanistic mountain, but then I traveled over the path to the psychodynamic mountain to explore that range. So assimilative integration, where you have, okay, Selman has a question. Selman, do you want to ask a question? Turn on your mic and ask the question. I can't hear you very well. Okay, sorry about that. We'll get to that, some questions later. Psychotherapy, so assimilative integration, where you have one foundational theory, but you explore others, is like setting up a base camp near one mountain, but being willing to explore other mountains. A meta-theoretical approach. Greg has a little eyeball on his map here, which represents a meta-theoretical perspective. So a meta-theoretical perspective allows us to stand back and look at the entire range. And then unification, which we're talking about today, involves trying to draw a map of the mountain range to help us travel more effectively and explore more terrain. So a mountain range is one of the metaphors, a map. All of these are different metaphors that we're going to use to try and describe what we're doing here. So I'm going to, so here's with that idea of mapping the territory. So we're using a meta theory view to create a holistic framework. So a holistic framework is like a map of the territory describing the relationship between different locations. And we're actually in training for unified psychotherapy in TUP. Today, we're going to be describing 2 different maps. One is a map of human functioning. And then based on that is a map of psychotherapy theories and how they fit together by targeting different types of functioning. So I'll give you a little bit of historical context. In the modern era, it was generally believed that if one theory was right, then other theories were presumed to be wrong. So in the middle of the 20th century, it was assumed that psychoanalysis, behaviorism, and humanism were incompatible because they were based on contradictory underlying assumptions. And we'll talk about some of those different assumptions on the next slide. So because these were contradictory, psychotherapists were encouraged to choose a single orientation and to practice it consistently. And this created competition between theories, and it created barriers to integration. So sometime, I'm going to turn 60 in a few months. So sometime during my lifetime, we went from a modern era to a postmodern era. So postmodernism suggests that truth is constructed and diverse theories each represent different lenses or viewpoints. So when I was young, the question, is psychoanalysis true or is behaviorism true, would have made sense to me the way I was trained to think growing up. But now, much later, in a more postmodern era, if you said which is true, psychoanalysis or behaviorism, or which is a better theory, I would have a different answer. I would say, well, psychoanalysis is better for understanding this, and behaviorism is better for understanding this. And really, they're just different ways of looking at the world. Metamodernism is a concept I've only learned about at the CEPI conference a month ago, but metamodernism advocates for integrated pluralism that emphasizes both complexity and holism. So postmodernism was a little dismissive in saying, we can't know the truth, so it doesn't matter. Whereas metamodernism says, no, we can tackle this, but we need to view complexity with trying to create holism. And that's certainly what those of us who are working on unification, working on unified psychotherapy are trying to do, is to look at complexity, try and create holism through a process of integrated pluralism. So that's a little bit about the historical context. So here's where we were 70 years ago. Here's where we were in the middle of the 20th century, that psychoanalysis, behaviorism, and humanism were three different worldviews, three different approaches, three different theories that had very different assumptions. One of the ways on the left axis, you can see that psychoanalysts and behaviorists thought that behavior was determined. And whereas humanists disagreed with both of them and said that people have free will. Up on the top axis, we've got internal versus external. So psychoanalysis believed the behavior was determined by internal factors like drives and conflicts, whereas behaviorism agreed that behavior was determined, but behaviorists suggested that behavior was controlled by external factors like the environment and patterns of reinforcement and conditioned responses. So this is, and this was a figure that I got from Charlie Whaler, who actually drew it on a napkin in a restaurant. And so when I was working on the first chapter of my book, I said, have you ever published this? And he goes, no, I've drawn it on a lot of blackboards. So Charlie was suggesting that this is a good way to understand where we were 70 years ago, where we were in the middle of the 20th century, that we had three theories that disagreed with each other. So over time, these theories became less contradictory. So psychoanalysis became more interpersonal, behavioral led to cognitive therapy, humanistic therapy led to experiential therapy, and other things were added. So this, if you want a little more about the historical context, that's in chapter 1 of the multi-theoretical book that I sent you last night or this morning. So it's important, as we try to integrate theories, it's important to remember that most psychotherapies were designed to replace earlier approaches. And so psychotherapy techniques in general were not designed to be combined. So the history of psychotherapy has included a lot of new theories that advocate, don't do that, do this. So even in, we started with psychoanalysis as Freud's theory, and behavior said, don't focus on the unconscious, focus on observable behavior. And then so later people said, family therapists said, don't focus on individuals, explore family systems. Cognitive therapy said, don't focus on the unconscious, focus on thoughts. Later, people said, don't focus on cognitive change, focus on emotions. More recently, people have said, don't change thoughts and feelings, accept them. So I want you to think about, were you taught any of these don't do that, do this rules? Don't do what we did 20 years ago, do something new. So I'm gonna turn off the stop share. So type, if you have an answer to the, were you taught any of these don't do that, do this rules. Let's take a look at those right now. So in the chat box, if you have a don't do that, do this rule, you can type it in the chat box. Anybody want to, in the chat box, have a don't do this, do that? Don't start the session. Let the client speak first. That's a good one. Don't accept clients' thoughts, change them. Don't give advice. Don't self-disclose, don't touch. I do remember hugging some clients in the 80s. I limit myself to high fives now. So that's, those are great examples. Don't self-disclose was one of the ones I was told. Okay, so let's go back to the slides, but those are examples of things that we were taught, and some of those are the same, and some of those are different, and the rules for what you should do or shouldn't do change over time. Will says, don't go over the time. Okay. So that's a little bit the historical context. So out of that context, the integration movement and the unification route. So psychotherapy integration rejects the historical competition and encourages therapists to draw from diverse sources. In specific, the route of unification represents an attempt to describe how most theoretical approaches fit together and complement one another. So now I used a map metaphor. Now I'm going to use a jigsaw puzzle metaphor. So we're going to propose a map, and then I'm going to teach you some methods for viewing clients holistically and working interactively with different dimensions of functioning. So I'm going to try and help you think about ways to sometimes do this and sometimes do that. So in the book I wrote that I published in 2008 about multi-theoretical psychotherapy, which is a precursor to unified psychotherapy, I suggested that 5 principles for integration, or 5 principles for unification. One, so my joke then was, I wrote a 500-page book and I can summarize it in 1 sentence. So here's my 1-sentence summary of psychotherapy. Psychotherapy should be intentional, multidimensional, multi-theoretical, strategy-based, and relational. So intentional integration is just that you should make purposeful choices about where to focus and when to change the focus. Multidimensional integration is recognizing interactions between different dimensions of functioning, and we'll be talking about that a lot today. Multi-theoretical integration is the idea that we should use diverse theories to understand clients and guide intervention. So it's not the pick one and practice it consistently, it's to use diverse theories and your use of different theories should be intentional. Strategy-based integration involves implementing interventions from diverse sources. And then relational integration is that all of these principles should be implemented within the context of an effective therapeutic relationship. And so Pei Yi loves the 5 principles. Thank you, Pei Yi. Okay, so another way to think, again, I know I'm throwing a lot of different metaphors at you. Some of them you will like some more than others. So we've already talked about a map. We've talked about jigsaw puzzle pieces fitting together. Here's another way. So is the idea of interacting systems. So biological functioning involves the interaction between different systems. The nervous system, the respiratory system, the circulatory system, the skeletal system, the digestive system. And so in medicine, which is clearly based on biology, we have specialists. You know, if you think your brain isn't working right, you go to a neurologist. If you are having trouble breathing, you go to a pulmonologist. If you are worried that there's something wrong with your heart, you might go to a cardiologist. So we have specialists in different fields, and there's no argument in medicine about whether dermatology is better than orthopedics or vice versa. If you have a rash, dermatology is a better treatment. If you have a broken bone, you should see an orthopedic specialist. But we're at a little different place in psychology. So psychological functioning also involves the interaction between different systems. So we'll be talking today about a cognitive system, about an experiential affective system, about a behavioral system. And these systems are influenced by interpersonal systems, family systems, cultural systems. So the idea, and this is an idea that I first heard from Greg Henriques in 2015. And the idea here is that intervention should be chosen based on an understanding of which system is malfunctioning or contributing to distress. So, and we're not there in psychology. There are plenty of people think I have been trained to practice acceptance and commitment therapy, and so I'm going to use that for everything, rather than saying, is this the right intervention based on what system is malfunctioning? So hopefully this summer in this webinar, we'll be training you to think about how to choose interventions in an intentional manner, okay? Oh, someone pointed out you could get the book for $400. Occasionally there's used copies for, please do not pay $400. I'll give you all the chapters this summer. So you won't get this nice, pretty cover, but the cover is not worth $400. So I'm on my last copy of the book. So if I see it for $70, I might use copy for $70. I might nab it, but don't pay $400 for it, please. So let's talk about our map of psychological functioning. So there are different ways to divide up the pie. What we're going to do today, I'm going to introduce you to a three-tiered model of psychological functioning with three tiers: immediate psychological experience, external influences, and internal influences. And you can disagree with me on these. I had a discussion a few years ago, is attachment internal or is interpersonal patterns external? So this is not a periodic chart. We're not like chemists who can count the electrons and neutrons and protons and fit it together. So this is not chemistry. This is still psychology, and this is just a heuristic device, and you can agree with parts of what I'm saying and you can disagree with others, and you might be right and I might be wrong. So let's start with immediate psychological experience. So the foundational idea here is that cognition, emotion, and behavior happen most of the time and are highly interactive. Humans are always thinking, feeling, and acting. So the second idea here is that cognition, emotion, behavior can be adaptive or maladaptive. And we'll talk about that more this morning. So that's the immediate psychological experience. So thoughts are part of a broader cognitive system. So some of the themes from many different theories here are cognitive distortions, irrational beliefs, cognitive schemas, cognitive fusion, narratives, justification system, existential meaning making, mindfulness, and imagery. And so those are, these are cognitive ideas. Some obviously are very mainstream ideas, like cognitive distortions from Aaron Beck, or irrational beliefs from Albert Ellis. Some of these are, mindfulness is a great idea because I like that it was proposed by the Buddha 2,500 years ago, but now it's, being empirically validated. I'm sure the Buddha is relieved to finally be empirically validated. And some of your favorite ideas may be left out of here, and I'm happy, I'm always tinkering with this, and it's not clear where some of these belong. So I've even had a discussion with a couple people about existential meaning making, whether meaning is a cognitive or a experiential construct. And there's not a right answer, because this isn't the periodic chart. We can't count the electrons and protons and neutrons. So emotions are part of a broader experiential affective system. So this is tricky because it is not clear whether emotions is the central idea here or phenomenology is. So in the middle of the 20th century, when humanistic and existential approaches came to the forefront, what they agreed on was phenomenology, that you want to understand the internal perspective of the client. I'm going to suggest to you that emotions are a good entry point into phenomenology. So sometimes when I teach this cluster of ideas and this cluster of interventions, sometimes there's more focus on emotions, sometimes there's more focus on that phenomenological experience. But some of the themes in this cluster are phenomenology, maladaptive emotions, emotion regulation, experiential avoidance, self-actualization, authenticity, awareness and experimentation, motivation, authentic happiness, and spirituality. So again, it's hard to sort these out, and I might be right and you may have a better way. I had a discussion several years ago with students about that spirituality is the internal part, and it's a part of the experiential affective system, but religion, the formal structural part, is part of the cultural context that influences your personal experience. So this one's a little tricky because it's emotional and phenomenological, and those are related, but not related in a way that I can clearly articulate. So the third part about immediate experience is actions, which are part of a broader behavioral system. So we're going to be talking about adaptive behavior, but we're also going to be pulling on traditional behavioral ideas from different paradigms over time, like conditioned responses, reinforcement and punishment, vicarious learning, problem solving, solutions, committed actions, habits, and skills training. So those are some of the themes that I've put together in to look at behavior. So again, at this core of psychological functioning is the interaction between cognition, emotion, and behavior. But this immediate experience is influenced by internal and external factors. So one more, sorry, I was skipping ahead. So it's important for integrative psychotherapists to be able to work interactively. So if you were trained in cognitive therapy, you were trained to usually use cognition as the way to change. So the way you change thoughts or emotion, the way you choose, if you were trained in cognitive therapy, you may have been trained to use cognitive change to promote changes in emotions or behaviors. The idea here as an integrationist is that we can work interactively and we can work on any of these three dimensions. So integrative psychotherapists can work interactively with clients' thoughts, feelings, and actions. Each of these dimensions can be explored in depth and can be used to initiate the process of multidimensional change. And different phases of treatment may involve a shifting focus. So I'm suggesting to you that working interactively with cognition, emotion, and behavior is ideal for most clients. Okay, so here's where I want you to reflect on practice for a minute. I sent most of you a worksheet and asked you to print it out. You may not have done so. It's okay. It's not a very complicated worksheet, but I want you to reflect on practice. And so the first reflection, and there's a worksheet. If you want to, after we finish the 5 sessions of level 1, if you want a certificate of participation, I'm going to have you ask you to send the worksheet, a copy of the worksheet for each session to me. I'm not going to have you take a quiz because we're not able to offer continuing education credits for this one, but if you want a certificate, you can just send me your worksheet from each session. So So I want you to think about which of these dimensions of immediate psychological functioning do you focus most often in psychotherapy? Some of you will focus more often on cognition, some emotion, some on behavior. So go ahead, and if you want to, in the chat function, go ahead and type which one of those you focus on the most, cognition, emotion, or behavior. On the worksheet, you can also identify which one you focus on the least, and if you have a rationale for these preferences. So let's look at the chat box and see if people more often focus on cognition, emotion, or behavior. Okay, I got to put my reading glasses on that. Emotions, behavior. Somebody said behavior now, before emotion, cognition, although I regularly share the triangle with clients and try to hit each one and where they feel they want to target. Yeah, and that's what we're going to be talking about today, asking the client where they want to target. Do I have to pick? No, you don't have to pick. Emotions the most, behavior the least. Emotion, cognition, emotion. When I was in Taiwan, I focused on emotion because that was the culture in Taiwan. Recently, I focused on cognition, emotion, behavior. Cognition, I see each of these as a gate, and the changing any one impacts the other. So I regularly try to encourage the client to come at it from all different angles. I agree with you, Jerome. Behavior, all of them. I focus a lot on behavior. So, one of the questions. Let me go back to the screen. One of the question is, do you have a rationale for these preferences? So, and I call them preferences because I think I know which flavor of ice cream I like to eat the most. So if cognitive therapy, emotion-focused therapy, and behavior therapy were ice cream flavors, then emotion-focused therapy would be my favorite ice cream flavor. But not all of my clients need or want that same flavor. So I want you to think about the preferences, and some of them will be because my professors taught me to to think that way, or because cognitive therapy has more research than emotion-focused therapy. But I want you to think about some of those preferences. So let me pause a moment and have a drink of my tea before we move to the next section. Okay. So one of the themes of this webinar is becoming a more integrative psychotherapist. And so as we look at this map of psychotherapy, you will recognize territories that you know well and areas that you might want to explore. Even just seeing the list of places that all of you are from, it's like, oh, I wish I could go to Copenhagen. I've never been to Japan, so it's similar to that. So this is your travel list. So becoming a more integrative psychotherapist involves an ongoing process of professional development. And you can identify areas for growth that will expand your skills. So and just where we're starting this at level 1, looking at cognition, behavior, and emotion. If your graduate training emphasizes cognitive and behavioral approaches, it may be helpful for you to increase your competency in working with clients' emotions, just to round it out. In level 2, when we talk about the external influences, we'll be asking you which of those you want to learn about. So we're back to our 3-tiered model of psychological functioning. We're moving on to the second part, the external influences. We're looking at external influences, and we're going to be talking today about 4 external influences. And again, this is the way I've constructed the map with some input. The model I'm presenting here is very similar to Barbara Ingram's and Jeff Riamagnavita and Jack Anshin's and Greg Henrique's. So there's some consensus there, but you may have things you can organize the world in a different way. So Here are 4 external influences. So the interaction between cognition, emotion, and behavior are influenced by, from left to right, development across life experiences, interpersonal patterns, families and other microsystems, and sociocultural macrosystems. So I'm going to be introducing you to these ideas, but we're going to explore all of these in greater detail in level 2 training later in the summer. So this is an introduction, but we'll go deep. We'll do a deeper dive later in the summer if you want to join level 2. So development across life experience is basically everything that's ever happened to you. So this includes normal psychosocial development, such as in the way that Erik Erikson described it. There are normal developmental transitions. I am meeting on Monday with a financial planner to talk about retirement income. So that is a normal developmental transition for someone who has worked hard for a long time, and I don't want to work 5 days a week anymore. So planning my retirement is a normal developmental transition. Lifespan wellness, career life development. So this was interesting. I was working on this. I've been working on this model for a long time, and I was assigned a career counseling class. I started teaching a career counseling class, and I was like, oh no, where does, and earlier versions of my model didn't have development across life experience. And I said, oh no, what's career counseling? And so I can now articulate career counseling is a developmental intervention to help people move from school to work, or from work they don't like to work they do like. So there's role transitions. So those are normal development, but there's also developmental disruptions. And developmental disruptions include things like adverse child experiences, trauma, crises, and unexpected losses. So when we focus on development in psychotherapy, we are focusing on both normal development and disruptions in normal development. The second area that influences the interaction between thinking, feeling, and acting is interpersonal patterns. And this has been the focus both of psychodynamic theory, of some psychodynamic theories and interpersonal theories. So some of the themes, interpersonal themes in psychotherapy include relationship patterns, attachment styles, the therapeutic alliance, transference and countertransference, interpersonal theory of personality, so like Harry Stack Sullivan there, impact messages, and interpersonal problem areas. So interpersonal psychotherapy for depression, the Klerman and Weissman version defines interpersonal very differently the way that people like Sullivan or Horney would have suggested, but they talk about 4 interpersonal problem areas that often impact depression. So many of these traditions have been around for 50, 60, 70 years or more. And so there's lots of themes, and some ideas like interpersonal has been defined in many different ways over the decades. The next external influence is families and other microsystems. So the way that we think and feel and act is impacted by family systems, family roles, multi-generational patterns, family belief systems, homeostasis, microsystems outside the family, social support, and role transitions. So no psychotherapist would disagree with me that the way we think and feel and act is influenced by the family we grow up in, the social systems we interact with on a daily basis. So this is the last and kind of the biggest external influence. And some of these are nested. You can see how interpersonal patterns exist within family systems, which are impacted and shaped by cultural context. So some of these can be thought of as nested. So sociocultural macrosystems include cultural context, macrosystems, the idea from Bronfenbrenner, cultural identity, social roles, how people are impacted by oppression and privilege, including racism and sexism and heterosexism and transphobia. This includes social problems, like how our functioning is impacted by poverty and crime and war. And then religion is a external factor that we suggested may impact the internal experience of spirituality. So many of these, and we'll talk about this as we go forward. So many of these have an external part that is internalized. So as we talked about interpersonal patterns. Interpersonal patterns is how we've interacted with people throughout our lives, but that is internalized in the form of an attachment style. If I have a insecure attachment style, that is the way I have internalized these interpersonal patterns I've learned throughout my life. So many of these external influences are internalized. So culture is what I learn, but then my cultural identity is how I internalize that. So we'll be talking throughout the summer about this interplay between the external factors, but how they're internalized. So I want you to think about for a minute, again, reflecting on practice, which of these external influences do you most often focus on in psychotherapy? Do you focus on all these life events and normal development across the life experience or developmental disruptions? You focus more on interpersonal patterns, so those dyadic relationships. Do you focus most often on families and other microsystems, or do you focus on social, cultural macrosystems? So again, let's have people type into the chat box, which of these do you focus on the most? So interpersonal patterns, macrosystems, interpersonal patterns. Interpersonal, marriage and family therapists, so definitely that, but work with college students, so a lot of development in interpersonal patterns. Yeah, I work as a college counselor, and so I talk to a lot of people about, okay, this conflict with your parents is a part of the long-term process of individuation and separation. So, and normalizing that as a developmental process is something I do a lot. So, okay, so lots of interpersonal patterns. That's probably the modal response. So let's move on. We've been talking for an hour, or I've been talking for an hour, and we only have a half hour left. So let's move on. We have a demonstration that I want to make sure we get to. Okay, so next up we have two. So this is the idea of working contextually. An integrative psychotherapist can focus on different external influences based on the unique experience of each client. In most cases, our clients cannot directly change external influences, but we can help them find more adaptive ways to think about, feel, and act toward their experiences in external environments. So we can't change the family system, but you can help clients think about their family differently, or explore different emotional reactions to their parents or actions that may interact with the family system, for example. So that'll be working contextually, will be working contextually will be the theme of the level 2 training. So in the same way that I asked you to think about how you want to expand your repertoire, this is same question. For the external influences, you may have had a lot of training in family systems, but not a lot of interpersonal patterns, or vice versa. So think about over time how you want to become more integrative. Third part of the 3-tiered model is internal influences. And we'll be talking about 2 internal influences: unconscious processes, conflicts, and defenses, and then biology, physical health, and maturation. So some of the themes from some of the psychodynamic themes from that describe unconscious processes are Freud's idea of the unconscious, the psychodynamic relationship between different parts of the unconscious, internal conflicts, childhood experiences, defense mechanisms, the interaction between the id, ego, and superego, resistance, and dreams. So these are all ideas related to the unconscious that we'll be exploring in a little bit in level 2 training. We can also look at the way that biology and physical health impact the way we think and feel and act. And that involves using a psychosocial model, looking at psychiatric disorders, physical health, health psychology, sensory motor psychotherapy, mind-body connection, substance use disorders, and the way that we can use different behaviors to activate different neurotransmitters. So again, just because I'm getting short on time, I'm not going to have you type in, but I want you to think about whether you focus more on the unconscious or more on biological health. So you can write that on your worksheet, but we're not going to do the chat box just because I want to keep moving. So again, the idea here is working contextually, that when we're working to change or clients' thoughts, feelings, and actions, we can be aware of how they are impacted by unconscious processes and biological health. And you can become more integrative over time by expanding your skills. So here's a different way of organizing the three-tiered model of psychological functioning. So you've got cognition, emotion, behavior there in the middle. You've got the 4 external influences on the top of the circle, and then you have the 2 internal influences on the bottom of the circle. So are there any questions about the three-tiered model of human functioning? And you may notice that some of your favorite constructs have been left out. I'm happy to, again, I've been tinkering with this model for a long time and add and change things over time. So probably I'm going to keep moving, so I'm not going to answer these questions right now, but more for reflection and discussion over time. And Mads thinks it makes perfect sense. So that's clearly an indication that we can move on. Thanks, Mads. Okay, so we've got this model of human functioning, and I'm gonna say that there are 2 primary applications of that. One is to understand clients in a holistic manner. So this is a way of thinking about clients, thinking about how their thoughts, actions, and feelings interact, and how these cognitions, emotions, and behaviors are influenced by external influences and internal influence. So that's about the clients. The other way is to organize psychotherapy interventions into a unified framework. So this is kind of the punchline, the pinnacle. This is the punchline, is the next slide. So I'm going to give you a minute to let this soak in. This is a lot of ideas, and this is as complicated as we're going to get today, and then we're going to simplify things again. So let this soak in just a little bit. And I'm going to take a drink of tea before I read this to you. So this unified framework for individual psychotherapy suggests that cognitive interventions focus on thoughts and the cognitive system. Experiential interventions focus on emotions and the experiential affective system. Behavioral interventions focus on actions and the behavioral system. Developmental interventions focus on development across life experiences. Interpersonal interventions focus on interpersonal patterns. Systemic interventions focus on families and other microsystems. Cultural interventions focus on socio-cultural macrosystems. Psychodynamic theories focus on unconscious processes, conflicts, and defenses. Biological interventions focus on biology, physical health, and maturation. So this is a unified framework. It differs in wording a little bit from some of the other unified psychotherapists, but it covers all the same territory, but we may use slightly different words. So this is a lot. And so I'm going to simplify it in a minute, but let me say make a couple comments about this unified framework before I then go to a more simple foundation. But if this is a little bit overwhelming, that's okay, because we've got several more weeks to look at this more slowly. So This framework does not try to reconcile differences between theories. So Arnold Lazarus thought we could combine strategies in terms of technical eclecticism, but as a modern thinker, thought that we shouldn't smush the theories together. So we're not theory smushing, we're just laying out the relationship. Theoretical synthesis is not the goal. So people like Paul Wachtel have tried to synthesize behavioral, psychodynamic, and systemic ideas. We're not trying to fit them all together. We're just seeing where they fit beside each other. So this framework describes the relative emphasis of diverse approaches. So we're not trying to unify the theories because unity is found in human functioning. So my colleague Jack Anshin says this really articulately. Unity is found in human functioning, not in one all-encompassing theory. So that's why we're saying that these interventions focus on this part of human functioning, but we're not trying to fit the theories together because humans operate in a unified manner. Our thoughts, feelings, and actions interact. And so unity, I think that's a really important part. Unity is found in human functioning, not in one all-encompassing theory. So the conclusion here, and I think most of you are drawn to a workshop like this because you believe along with me that each of these theoretical traditions has something to contribute to our understanding of human functioning and our ability to promote multidimensional adaptation. So somebody asked, is there hierarchical relationships through the three tiers? So they're not hierarchical, but they are in immediate experience, internal and external. I don't know that psychodynamic and biological belong together in the same way. So immediate experience, external and internal is my heuristic, and it may be helpful for you or you may disagree. So this is complexity. So we're going to move towards simplicity in a moment. Okay. You might have some questions and we can discuss those over time. So training in integrative psychotherapy has to balance complexity and simplicity. We need to think about in a complex manner about human functioning because human functioning is complex and our clients are complex and their problems are complex. However, if we try to learn everything at once, we will become overwhelmed. So training in unified psychotherapy begins with a simple foundation. So we're going from complexity back to simplicity. So here's a simple foundation for unified psychotherapy. Cognitions, emotions, and behaviors interact. Cognitions and emotions and behaviors can be either adaptive or maladaptive. So I want you to think about, we're focusing on three, at the simple core of this training method, we are focusing on cognitions, emotions, and behaviors and whether they're adaptive or maladaptive. And this is a simplification. And Shelley, stages of change is a great idea. We'll talk about that somewhere along the line. One of the things I like, and the trans-theoretical models was the first, unified model that I was exposed to, and that. So yeah, stages of change can be applied to any of those things, and I hope that you bring that up throughout the training. Okay, so this is cognition, emotion, behavior can be adaptive or maladaptive. I think this is a oversimplified idea, and when I say it that way, it's oversimplified but helpful, and it reminds me of one of my favorite movies. Hold on. So at the beginning of The Wizard of Oz, this is a picture of Glinda the Good Witch. And at the beginning of the Wizard of Oz, Glinda asks Dorothy if she's a good witch or a bad witch. And she has this very 1930s feminine voice. She says, "Are you a good witch or a bad witch?" So this is my oversimplified way that when we think about whether thoughts, feelings, or actions are adaptive or maladaptive, we're oversimplifying, saying, is this a good thought or a bad thought? Is this a helpful emotion or an unhelpful emotion? Is this a good action or bad action? So from cognitive therapy, we have this idea that thoughts can be functional or dysfunctional. And I'm not going to read these slides because I want to get to the demonstration that we have recorded. From emotion-focused therapy, there's the idea that there are adaptive and maladaptive emotions. And from behavior therapy, we have the idea that some actions are effective and some actions are ineffective. And so, those will be things that we'll be talking about next week with cognitions, the week after about emotions, and then the third week after that about behaviors. So this is an example. This is a personal example. I lost my wife to cancer about 16 years ago. And at the one of my maladaptive thoughts that occurred even before Carolyn died, when I knew that she had terminal cancer, I said to myself, I can't do this on my own. I will fail as a single parent. I knew that even as I said it to myself, I knew it was probably false. So more adaptive thought is parenting on my own is going to be more difficult. My daughter needs my support. One of the helpful cognitions was, I will probably not be the worst single parent in the world. And I was not. I was not the worst single parent. I was pretty good. So maladaptive feelings at that time were hopelessness and paralyzing fear. More adaptive feelings were feelings of love and attachment toward my daughter, determination and hope. Maladaptive actions were shutting down. Adaptive actions are seeking support and moving forward. So we'll be thinking about this a lot, about looking at our clients to figure out whether the interaction of their thoughts and feelings actions are helpful or not. So a simple foundation for intervention is that we can explore or transform cognitions, emotions, and behaviors. So we'll be learning that the next 3 weeks. So I'll present to you some key strategies training, which will allow you to focus on a specific dimension that are divided into the exploration phase. So I'll teach you 4 skills for exploring cognition, behavior, or emotion. I'll teach you 4 skills for transforming cognition, emotion, or behavior. I told you that this adaptive, maladaptive, and explore, transform are oversimplified. So the first level of complexity that we're going to add back on is sometimes we're going to explore and sometimes we're going to accept. So traditional therapies like cognitive therapy say that you should change your thoughts. Newer theories like acceptance and commitment therapy says you might need to accept some of your thoughts. Harm reduction says you might need to accept some of your bad habits. So we're going to be talking about the interaction between exploration, change, and acceptance, but there we're adding a little bit of complexity. So we're going to start simple and then expand into complexity. So here's an example of change and acceptance. If you are a young person, young gay person, a gay young adult, and you're being rejected by your family, you might need to change thoughts like there's something wrong with me, but you may need to accept accurate thoughts like my father won't accept my sexual orientation. If you're feeling shame, I may want to help you change that feeling, but if you're feeling angry, I might want to help you accept that anger. Your action, you may need to change the way you interact with your family so that they don't criticize you directly, but you may want to accept, I may help you accept the idea that you want to be cautious about coming out. So we're going to be doing, I'm going to move to a demo pretty quickly. So a unified treatment planning involves 4 steps: conducting a multidimensional survey, establishing an interactive focus, formulating a multi-theoretical conceptualization, and choosing intervention strategies. I've got a recording of a really nice multidimensional survey, which is the first part, and we're going to just go ahead and do that demo now. So one of the participants in this workshop is Stephanie Westcott, who's a student here at New Mexico State University and has done a practicum here at the Aggie Health and Wellness Center. And so she is going to be portraying not herself, but a client who's a little bit of one of her clients and a little bit of our imagination. But This is a multidimensional survey of Eileen. Eileen is a 30-year-old cisgender Indigenous American female. She's a graduate student in nursing. She identifies as cisgender and heterosexual. She described herself as spiritual but not religious. Her presenting concern is anxiety with panic attacks. So we're going to watch a video demonstration of a multidimensional survey, and then we'll have a few minutes for questions. And on your worksheet, you have a copy of a multidimensional survey. So I used this worksheet when I was talking to Eileen a few days ago. So Eileen, we've talked about your anxiety in a general way, and you've talked about how sometimes you have panic attacks, and you've talked about how it comes out a lot in school and sometimes with friends. What I want to do next is to describe 3 parts of your anxiety: your thoughts, your feelings, and your actions. And I'm going to fill out this little worksheet as we go on that just talks about those 3 elements and how they might be related. Okay?
Okay.
So in describing kind of the general pattern of your anxiety, do you want to describe your feelings first, your actions first, or your thoughts first?
Probably the feelings. That's what I noticed first.
Okay, so let's start with the feelings. So when you're anxious, what emotions are you experiencing?
Because I feel scared.
Scared. And when you feel anxious and scared, do you know what you're scared of?
Scared of failing stuff.
Okay, so and we've talked about that, about your school and your grades, that there is that you're scared when your grades aren't good, and there's that sense of there's that fear of failure. Are there other parts, other fears that contribute to your anxiety?
I guess I'm also afraid that people are like not gonna like me.
Okay. And when you are afraid that people won't like you, does that feel like a fear of judgment or fear of rejection or?
Rejection.
Okay. So there's at least 2 different fears: a fear of failure and a fear of rejection.
Mm-hmm.
Okay. And we will, over time, we'll just explore whether those are distinct or overlapping or whatever. What other emotions come up for you related to your anxiety? So we have a fear of failure and a fear of rejection and a fear that people won't like you. What else?
I guess I also feel disappointed.
Disappointed? And what do you feel disappointed in?
Myself.
So is that when you don't live up to those expectations? So is disappointing yourself the flip side of the fear of failure?
I think even whenever I do well, I feel like I can always do better.
Okay, so even when you get an A, there's a why didn't you get an A+?
Exactly, yeah.
Okay, so we're starting to identify some of the feelings that might be associated with we're starting to identify some of the thoughts that might be associated with these feelings. So let's go ahead. I've got these three feelings: fear of failure, fear of rejection, and disappointed in yourself. Let's see if we can identify some of the thoughts that are associated with each of those feelings. So when you are afraid of failure, what's the thought associated with being afraid of failing?
That I always need to work hard.
So you always need to work hard to avoid failing.
Yeah.
Okay, that makes sense. That makes sense how those fit together. So with the fear of rejection, the fear that people won't like you, what's the thought associated with that fear?
Can you say that again?
So for the fear of rejection, the fear that people won't like you, what is the thought that fuels that fear?
That I need to prove myself.
Okay. So you want to prove yourself to other people.
Yeah.
And we'll probably, as we explore that in a little deeper, it'll be important to see who you're trying to prove yourself to. But let's leave it at that now. So, so we have two thoughts associated with those two different types of fear. The third feeling that you had was that disappointed in yourself. What is the thought that is associated with feeling disappointed in yourself?
That I need to prove to myself I can do it.
Okay, so there's two different thoughts. So the fear of rejection is I need to prove myself to others. And the fear, the disappointing yourself is I need to prove to myself I can do it. Is that right?
Yeah.
Okay. Okay. So let me show you what we've got so far. And then I want to think about actions next. So we've got the I always need to work hard, which is associated with fear of failure. We have I need to prove myself to others, which is associated with a fear of rejection and the idea that other people won't like you. And then we have the third feeling of disappointed self, which is associated with thinking I need to prove to myself I can do it.
Yeah.
So with these interacting thoughts and feelings, the interaction between our thoughts and feelings often generates our actions. So what kind of actions do you notice that are part of this pattern of anxiety?
Well, I'm up late doing schoolwork all the time.
So because you need to prove yourself, one way to do that is to stay up late doing schoolwork.
Yeah.
And what other actions are associated with this anxious pattern?
I'm just busy all the time. Like I take on too much.
And because you take on too much, it takes you until late at night to do all those things.
Yeah. And I often like forget to eat.
Okay. So you are forgetting to eat sounds like, an example of neglecting self-care.
Yeah.
So let me show you what we got so far. We now have 3 actions which are associated with those thoughts and feelings. You're up late doing schoolwork. You are busy all the time and take on too much. And then you forget to eat, which is an example of neglecting your self-care.
Mm-hmm.
So we've got thoughts, feelings, and actions. These always interact with each other, but they interact differently for different people. So when you think of the anxious pattern, does it start as an action? Does it start as a feeling? Or does it start as a thought? We're going to draw some arrows here.
I think it probably starts with a feeling.
Okay. And which of the fear of failure, the fear of rejection, or the disappointment, which of those kind of is the prime mover for the anxious pattern?
I think it's the fear of failing.
Okay. So we're going to start with fear of failure. And then does the fear of failure impact your thoughts next or your actions next?
I think my thoughts.
Okay. And so it's the I always need to work hard.
Yeah.
Okay. So I'm going to draw a little arrow from the fear of failure to I always need to work hard. And then which of these actions does that fuel the most is the typical driving force of the anxious pattern?
Probably the busy all the time and taking on too much.
Okay. Okay. So we've got a pattern here, which is both complex, but then we're trying to streamline it a little bit, where the fear of failure leads you to think I always need to work hard, which makes you kick into action in terms of being busy all the time and taking on too much. So if we were going to explore this pattern and try and change it over time, where would we start our process of exploration and change? Would we start by focusing on the feelings, the thoughts, or the actions?
Probably the thoughts.
Okay, okay. So I always need to work hard, and even once we start digging in, we'll be looking at the always. Okay, so that is a demonstration of a multidimensional survey, which is a part of unified treatment planning. We only have a few minutes left, and I didn't change the settings, so this may automatically turn off in 5 minutes, which I will try and make sure that doesn't happen next time, but it might happen. So if you have any questions or comments, we're going to be talking about this in depth. So we'll be talking next week about focusing on thoughts, the following week emotions, then behaviors, and then we'll come back to this idea of unified treatment planning. So you'll see you'll see this video again. We'll be putting this into practice in 4 weeks. But does anybody have any questions or comments? And some people are appreciating the demo. Thank you. Thank you. Stephanie's on listening. So thank you, Stephanie, for helping me by portraying this fictional client named Eileen. But if you have any questions you want to ask, you can turn on your microphone and ask them verbally, or you can type in the chat. Okay, so we're going to have the next few weeks to talk. So when leaving without enough space is nice when it's like, and now I'll see you next week. So let me pull up the last couple slides. I'm going to encourage you to practice this on your own. So you can practice a multidimensional survey either with yourself. If you ever have anything distressing happens, you can create your own, you can do this, or you can do it for a client. And even if you haven't specifically asked this with a client, ask the client, you can usually identify their thoughts, feelings, or actions. Or if you can only identify their thoughts and feelings, that will tell you that you need to focus. It may be good to do this with actions. If you feel like you could do this on your own, start practicing. That would be fabulous. Some people don't want to ask the client, where do we want to start, until they feel more confident exploring all three. So you may not want to use this if you say, where would you like to start our focus of exploration and change? If you're saying, don't pick actions, don't pick actions, don't pick actions, that might mean that you're not quite ready for that. But hopefully in a few weeks, you'll be able to, and I'm going to encourage many of you after level 1, before level 2, to practice doing the multidimensional survey, at least this first part of it, on thoughts, feelings, and actions. So if you want to communicate with me, you can email me at drjeffeharris@gmail.com. I've invited most of you to join a Google group called TUP Updates in Training in Unified Psychotherapy. And if you have questions, if you ask them on the Google group, the TUP dates, I will answer them, because if you have a question, probably other people have questions. This would be a great place to say, what about such and such idea? Do you think that's an external influence or an internal influence? And I don't have the right answer, so I will probably say, where do you think it fits? So please use the TUP dates Google group to add some discussion. Maria says, complexity in real experience looks simple, like in this example. Yeah, okay, all my demos are oversimplified. So disclosure, I wanted it to last less than, we were shooting for 7 minutes and it took 10 minutes. So yes, that dialectic between complexity and simplicity, we will be talking about that for the next several weeks. So for example, if you have a lot of training in cognitive therapy, next week is going to seem a little bit simplistic to you, but it'll hopefully be a good review, and it will help you think about how you can train other cognitive therapists. So we may get cut off here in a minute. So thank you. I will stay on until they cut me off if anybody has any questions. But again, I don't know if the settings are like that. I hope all of you join us next week. Summers are tricky, so if you miss a week, I think these webinars will be posted on the CEPI website so that you can view the ones that you might miss. So if you have any questions, please, any more complex questions, please put them on the TUP Dates Google group and we'll begin a discussion. If you feel like practicing a multidimensional survey this week, it's in the worksheet that you can print out. If you didn't get the handouts or an invitation to TUP Dates, you can email me at drjeffeharris@gmail.com. And this has been lots of fun. Like I said, I've been working on this for many years. So training in unified psychotherapy is version 3.0. And I expect there will be a version 3.1 and 3.2. If you want to, there's a slide on here that says if you want to copy any of these materials, you can, as long as you give me credit. If you want to translate these into other languages, you can, as long as you give me credit. If you want to use these or translate these, please keep in touch, either through the email or through the TUP Dates. And I'm looking forward to working with you all throughout the summer. Thank you all very much.